Here we are on the couch with Dr. Alex Bartle. Alex is from the Sleep Well Clinic. Welcome, Alex.
Thank you.
So, Alex, sleep takes up a huge amount of our life, but we give it probably not much thought about it unless we don't do it well.
That's right. Yes, if you don't sleep well, you certainly know about it, but very little training is done in undergraduate training, for example, so most people pick up about sleep as a postgraduate in terms of medicine. People used to think you'd just go to sleep and wake up in the morning and it was a dead time, semi-death really. But now, over the last 20 years particularly, there's been a huge amount of research. And whilst the research has expanded hugely, the amount taught in training is still very small. This third of our lives that's so important. It's one of the 3 pillars of health, including nutrition, exercise, and sleep. And if you go into a bookshop, for example, you'll see lots of stuff on nutrition, you'll see lots of stuff on exercise and physical health, but you see almost nothing on sleep.
So on the scale of sleep, from someone not sleeping that great and they can't really define what it is, but they don't feel rested, through to the more severe sleep apnea and what have you, where do you fit into the whole program as far as sleep?
Right, being a private clinic, it's totally subjective. If people don't think they're sleeping very well, then they will come in and try and get sorted out. And it's often, for sleep apnea, for example, it's very frequently the partners who will kick them along.
Yes.
Can't sleep with you, you need to sort it out.
Yes.
For insomnias, which about half of what I see is insomnia patients, and they really are self-selecting. They're not coping well, they're not sleeping well, and they're fed up with the tablets they're giving, and often they're starting not to work, so where do we go now? And so it's often a question of starting to get some behavioural stuff, which is what I do. Then there's children. I deal with babies and children who can't sleep, so if mums come in and they're desperate because their little ones won't sleep, then we'll deal with that too. So we deal with children. And shift work, of course, is always a big sleep problem. Yeah.
So you say behavioural, so it's not, you don't just give bigger sleeping tablets than anything else?
No, that's right. I spend a lot of my time weaning people off tablets. Yes. I've got nothing against sleeping tablets, not antipsychotics, which are the quetiapine. Yes. They're really not ideal thing at all. But Zopiclone is a very good sleeping tablet. It's got a half-life of 4 to 6 hours, so it's ideal. By the time you get up in the morning, it's usually gone and people get a good sleep. That's why they're sort of addictive, is because you get a good night's sleep with them. Yes. But no, all the studies that I'm aware of show that the behavioural strategies are always better than any tablet that you could use. Right. Tablets in the first stages are fine, and even for the first year or two they might work very well, but eventually they start not to work, and you get that tolerance.
So is it the fact that people don't feel as though that they get the hours, or they don't feel rested, or a combination of the both?
Yeah, both of those. The main thing really is you don't feel rested during the day. Most sleep problems result in poor functioning during the day. And as I say, if you slept for only 2 hours and felt great all day, why would you want to do any more? But the fact is we can't do that. No. And so either it's poor quantity, i.e. insomnia, you're not getting enough hours of sleep, or just behavioural. A lot of people just don't let themselves sleep for more than, say, 5 hours, thinking that's a really great idea and get so much more done. Well, actually their functioning will be below par. Or it's poor quality, as in sleep apnea particularly, but also there's this thing called restless leg syndrome, and that results in a condition called periodic limb movements, which is actually relatively common, twitching of the leg, and when they do that, it causes arousals in the brain, and that interrupts their sleep cycles. Okay. So restless leg syndrome with periodic limb movements in sleep, and sleep apnea are the two major ones.
So what treatment for restless leg syndrome?
Well, that's really a medication.
Yes.
It's a low brain iron that leads to low dopamine levels, so we use dopamine agonists. The most popular one, the most common one we use at the moment in New Zealand is ropinirole. But we're soon, hopefully in the next year or two, to be getting a medication called pregabalin, which is an isomer of gabapentin, which is very effective, without some of the side effects you get from ropinirole.
What about someone that just yawns during the day all the time? Is that lack of sleep or
it's
lazy breathing?
No, yawning is a very interesting thing. Nobody really has worked out, because there's this, if you started yawning, I'd start yawning, for example. So there's empathy sort of thing. But also it is to do with tiredness. But on the other hand, sometimes, say, if I'm doing some exercise, say on an exercise cycle, I might start yawning. well, that's not lack of breathing. I'm
No.
puffing away to my heart's content,
Yes.
but I still might yawn. So yes, it's more common in when you're tired, absolutely. And so there is something to do with fatigue there. So if you're yawning all day and in meetings and on the way to work, then you're probably not getting enough sleep of some sort, either quantity or quality.
Okay. So, so I'm a GP, and patients come to me. And first line is usually, I'll give you some tablets.
Yep.
Then they come back,
Yes.
and you give them more tablets.
Yeah.
So the process of getting referred to your clinics.
Well, I mean, alert signals come up saying they're coming back for the second or maybe the third time. We need to do something else. And so sleep clinics, we've got them from Invercargill, Dunedin, Christchurch, Nelson, Wellington, Hamilton, Christchurch, Whangarei and Tauranga. So there are 9 altogether. At the moment, we're hoping to get one in Hawke's Bay area. But they need to ring the central base, which is in Christchurch. And that's the 0800 number. So if you look up Sleep Well Clinic,
Yes.
it comes up very quickly on Google.
Google, yes, good.
And ring the 0800 number, and they'll find out what your problem is. You know, child who can't sleep or sleep apnea. Find out where you live, so the relevant clinic for you, and then they'll make it in a time. I might say that almost anywhere now, I do quite a lot of insomnia consultations via Skype, so it doesn't really matter where you are, and they work extremely well. Yeah.
Okay. So the conference for you, how's it been?
It's been very good.
Yes.
Yeah, no, I generally come to all the GP conferences,
Yes.
and the main thrust of that is I'm passionate about the fact that sleep should be in general practice. It's GPs who should be doing sleep stuff,
Yes.
not specialists. This is where the first port of call.
Yes.
And as people have been to the talks, we'll see sleep issues impact on almost any part of your health. Reflux, getting up to the toilet at night, depression, obviously heart attacks, strokes, diabetes, very much, independent factor, atrial fibrillation, polycystic ovaries, Down syndrome, you name anything, and there's likely to be a sleep problem. One of the people who came to my talks deals with addicts, for example, in addiction programs. They all have problems with sleep. So this is a universal problem, and who deals with the universal problems? GPs.
Yeah.
That's where it should be sorted. Yeah.
Great. Thank you very much.
Okay, pleasure.
Cheers.